much aid should the WHO provide to healthcare systems in developing countries? Are food insecurity support systems from developed to developing countries economically beneficial or detrimental? Should human rights violations be punished using withdrawal of international human benefits? These are all questions that have been asked repeatedly and that expose the inherent difficulty and ineffectiveness of the current international support system for developing countries. Now that a pandemic has ravaged even the richest and most developed of countries around the world, another unfair question must be asked. So the question brought before us today is, what steps does the international community need to take to ensure that impoverished countries have access to COVID-19 vaccines? And I believe there are three clear steps. First, we should encourage developing countries in administering vaccines themselves rather than sending in workers from our own countries. Second, we should fairly distribute vaccines at a price to developing governments based on their proportion of needy populations. And third, we should ensure international cooperation for a unified goal rather than each government distributing distinct vaccines. So first, why do rich countries not just send liberal amounts of excess food to poorer countries in support? Well, economists have figured out that this actually destroys the developing economies. Just think about it. If a food stand in Nigeria has two sections, one with American zucchinis that are selling at 60 cents a piece, and one with local Nigerian zucchinis selling at $1 a piece. Well, the Nigerian shoppers are, like American shoppers, going to choose the 60-cent ones, leaving the Nigerian farmers who farmed locally without sales. So the first step the international community needs to take to ensure that impoverished countries have access to the COVID-19 vaccine is that we should encourage developing countries to administer vaccines themselves, rather than sending in our own workers. This will help them develop their healthcare infrastructure further, as well as ensure that they have experience when faced with future healthcare crises. According to Hindu Business Line on January the 4th, the Indian government-supported healthcare is quite inexpensive, causing 15% of their citizens to neglect purchasing insurance. According to this article, allowing local healthcare to administer vaccines will solve part of their citizenry's insurance problem, encouraging many more to purchase health insurance. CNBC on January the 4th tells us that utilizing local health infrastructure in Nigeria during the AIDS pandemic caused more than $82 billion of foreign investment, not foreign aid, foreign investment to pour into Nigeria, allowing them to develop more effective hospitals and train more specialized professionals so that they were more prepared for the COVID pandemic this time around. Now, second, sometimes foreign aid is all about fairness to the needy. So the second step the international community needs to take to ensure that impoverished countries have access to the COVID-19 vaccine is we should fairly distribute vaccines at a price to developing governments based on their proportion of needy populations. The World Health Organization on April the 24th of last year cites evidence that a fair distribution by local HIV measures allowed the HIV vaccine to be distributed among African countries in a most effective manner, reaching the worst infected areas first and trickling down to the less intense areas. In fact, research shows it also minimized deaths caused by the HIV virus. Nature on November the 30th of last year tells us that pre-orders of COVID vaccines at that time were concentrated in developed and richer developing countries without a single African country showing up on the list of 20 or so countries. It's an extremely unequitable distribution that needs to be improved, especially since poorer countries have worse healthcare infrastructure in worse shape to take care of growing caseloads. And finally, the most important aspect to our strategy is teamwork. If developed countries work together, distributions will be faster and fairer. The third step the international community needs to take to ensure that impoverished countries have access to the COVID-19 vaccine is we should ensure international cooperation for a unified goal, rather than each government distributing distinct vaccines. CNN on December the 28th tells us that the last thing the world needs is hundreds of different vaccination campaigns. We are in a race against the virus, not between countries or companies. Collective action is how we defeat this pandemic. According to the World Health Organization, on April the 24th of last year, many countries have pledged to work together, but some still, in reservation of self-interest, are still unwilling to sign an international agreement to work together on developing countries' distributions. Bloomberg on January the 3rd tells us that many African countries have few vaccine doses available to them, as private companies are accepting much higher bids from developed countries around the world. Similarly, New York Times on December the 30th tells us that South African factories are making millions of doses of vaccines, but those are likely to be shipped straight out to Western countries who have pre-ordered hundreds of millions of doses. We see that developing countries will have to rely on developed countries to donate vaccines or sell pre-ordered ones at a lower price to them, which is not very likely to happen unless we work together. So we've answered another one of those unfair questions. What steps does the international community need to take to ensure that impoverished countries have access to COVID-19 vaccines? And I believe there are 3 steps. First, we should encourage developing countries in administering vaccines themselves rather than sending in our own workers. Second, we should fairly distribute vaccines at a price to developing governments based on their proportion of needy populations. And third, we should ensure international cooperation for a unified goal, rather than each government distributing distinct vaccines. So we've answered another one of those unfair, difficult questions that continues to plague the relationship between rich and poor countries. Obviously, international support is important, as we are all humans around the world, but how much and what kind of support is necessary? We cannot just pour money and excess resources into countries that need them. We have to consider economic factors and the long-term impacts of such support. I hope the methods I've suggested find a balance between the 2 extremes. And as the WHO says, we need to pledge to work towards equitable global access based on an unprecedented level of partnership, create a strong unified voice, build on past experience, and to be accountable to the world, to communities, and to one another. Let's defeat this virus together. Thank you.